Arsenic, a naturally occurring element found in the Earth's crust, has long held a dual reputation as both a medicinal agent and a deadly poison. While its infamy is often tied to historical assassinations and criminal cases, the true and far more pervasive threat of arsenic lies in its impact on human health. Silent, insidious, and often undetectable without scientific testing, arsenic continues to affect millions of people worldwide through contaminated water, food, air, and industrial exposure. Bitter Dose. Arsenic's impact on human health explores how this toxic element enters the human body, what damage it inflicts, and why it remains a public health crisis even in the modern world. Arsenic exists in two main forms, organic and inorganic. Inorganic arsenic, the more toxic of the two, is typically found in contaminated groundwater, certain pesticides, and industrial byproducts. Organic arsenic compounds, often present in seafood, are generally less harmful but still under investigation. The most common route of arsenic exposure is through drinking water, especially in regions where groundwater is naturally high in arsenic or where industrial pollution has tainted supplies. Countries like Bangladesh, India, Nepal, and parts of the United States have reported dangerously high levels of arsenic in well water, putting large populations at chronic risk. Once ingested, arsenic begins its destructive journey through the human body. It interferes with cellular respiration by inhibiting enzymes critical for energy production, damaging organs over time. Unlike acute poisoning, which can cause vomiting, diarrhea, and death in hours or days, chronic arsenic exposure builds slowly, with symptoms often misdiagnosed or overlooked. The early signs include skin pigmentation changes, lesions, numbness in extremities, and fatigue. As exposure continues, the risks become more severe. Cancers of the skin, lungs, bladder, kidney, and liver are all associated with long-term arsenic intake. The World Health Organization classifies inorganic arsenic as a Group 1 carcinogen, meaning there is sufficient evidence of its ability to cause cancer in humans. Children are particularly vulnerable. Exposure during developmental stages can impair cognitive growth, reduce IQ, and lead to respiratory and cardiovascular issues later in life. Pregnant women who ingest arsenic-contaminated water are at greater risk of miscarriage, stillbirth, and giving birth to babies with low birth weight. These effects extend across generations, embedding arsenic's legacy into family health histories. What makes this even more alarming is that many people remain unaware of their exposure, consuming contaminated water or food for years without visible warning signs. Food, too, plays a role in arsenic's pathway into the body. Rice, for example, is particularly effective at absorbing arsenic from soil and water. Populations that rely heavily on rice as a staple, especially in parts of Asia, are at higher risk of dietary arsenic exposure. Additionally, some agricultural practices and the historical use of arsenic-based pesticides have led to residual contamination in soils, affecting crops beyond rice. Even certain fruit juices and grains have tested positive for low but concerning levels of arsenic, prompting calls for stricter food safety standards. Occupational exposure represents another major concern. Workers in industries like mining, smelting, glass manufacturing, and pesticide production may inhale arsenic-laden dust or absorb it through the skin. Without adequate protective measures, these workers face an increased risk of lung disease, skin conditions, and various cancers. The problem is compounded in lower-income or poorly regulated regions, where workplace safety standards may be minimal or non-existent. Even long after exposure ends, arsenic can linger in the body, and its effects may surface years later as chronic disease. Public health interventions have made progress, particularly in identifying high-risk areas and improving water filtration technologies. Filters using activated alumina, reverse osmosis, and iron-based media have proven effective in reducing arsenic concentrations in drinking water. Community education programs in rural areas have helped promote the use of safe water sources and proper hygiene practices. Yet significant challenges remain. Testing for arsenic is not always routine, and many communities continue to use contaminated wells due to lack of alternatives. Furthermore, some filtration systems are costly or difficult to maintain over time, especially in impoverished regions. In recent years, scientists and health agencies have emphasized the importance of monitoring and regulation. Efforts to lower the permissible limits of arsenic in drinking water currently 10 parts per billion in many countries, have been debated, especially considering that even low-level exposure may contribute to long-term health risks. The balun,